everything to the right is ventricular activity. That helps me to interpret these rhythms. So I know that the atrial activity, whatever abnormality is going on to the left of this perpendicular, is going on in the atria, and anything to the right is ventricular. And that's just kind of a little trick that I devised to help, students understand how to look at these rhythms and interpret them, okay? And there's lots of different rhythms. Typically, a good telemetry technician will know about 26 different rhythms. You'll know what a normal sinus rhythm is, okay? You'll know what bradycardia is, what tachycardia is, a junctional rhythm, premature atrial contractions, premature ventricular contractions, trigeminy, bigeminy, quadrigeminy. You'll know what a first degree heart block is, a second degree, third degree, Mobitz. You'll know a flutter, a fib, VTach, VFib, asystole, STEMIs, bundle branches, torsades, DuPoints, artifact, I don't know if I said artifact, atrial tachycardia, supraventricular tachycardia. There's all kinds of rhythms.
That's all for the EKGs that you're gonna purpose of that?
I'm gonna do what?
No, I said the purpose of what you're saying, all these things.
Is for the telemetry certification, to study the telemetry.
Okay.
If you want that's part of the test, the final exam that you take for the telemetry. If
Okay.
you want the telemetry certification, you have to know all these rhythms.
Okay.
And a lot of it's gonna be self-study. I'm just giving you a little bit of getting your feet wet, so to speak.
Okay.
Is that your question?
No, not really, but
Go ahead.
what I was asking if that was all the stuff for the EKGs, I'm sorry.
No, EKG is just basically EKG lead placement.
Okay.
No, but I mean, if you
was just,
learn,
like,
if you,
overwhelmed.
yeah, if you learn EKG, I mean, you're gonna have to learn this anyway.
Okay.
But EKG certification is a 5-week course with 40 hours of clinical. So EKG certification doesn't come with the cardio phlebotomy, because you have to not only learn this, but all of the mathematics behind the leads and knowing what the poles are.
Okay. All right,
Yeah.
thank you.
Oh, you're very welcome. I just want my cardio people to kind of get a feel for if you have to look at a rhythm strip and you're working in a cardiology office, and let's say you start the IV on someone to do like a perstantine drip stress test, you do their vitals, you get their meds, do their history since the 6 months that they've been there, their vitals, whatever, and then you draw their blood for the preliminary blood work, and then you hook them up to the stress. You start to see some of this stuff, you want to get the doctor. Okay, they're not going to be running the treadmill when this happens. At that point, you recognize some of the dangerous rhythm.
Okay.
Trust me, this would not only be a rhythm, but you're going to see it manifest itself on the patient as well, with some of the signs and symptoms that we just talked about. Okay, you're very welcome. Good question.
Question.
Yes, sir.
I like how you divided the wave there. Would you associate the right side of R with left-sided heart failure?
The only
Or
thing.
ventricular heart?
Yeah, no, just ventricular. You'd have to look, my friend, at a 12 lead
Right.
to know where that heart failure is actually coming from. And typically in telemetry, we don't go into a lot of 12 leads because most telemetry technicians are watching up to 30 monitors, and they're all 6 second. Well, I mean, if they pull it, it's 6 seconds, but they're all just the basic 1 through 5, 1 through 6 leads that they're looking at. But that's a very good question. And I'm sure if you were to take a 12 lead on a piece of paper and you were to go ahead and take that perpendicular throughout, it may apply. Yeah, you might, because the leads show a different view of the heart each time. I mean, each lead in its entirety will show you a certain view. Very good question. And I'd like to know, see how that's, if it's actually applicable on a 12 lead printout. Good question. So this is just the beginning of telemetry. And obviously, it's not my intention to overwhelm you, but it is my intention to let you know that there is a lot of studying that goes into this to be able to get a telemetry certification. Okay? Next week, you're basically just having the heart test. We're not going over SA nodes, AV nodes. Next week, you'll be tested on the heart, because it'll be your 4th week. So, any questions? Any questions so far on the heart and the blood flow to the heart and the electrons, things like that? Yes, ma'am?
Is it, online?
Yes. Yeah, it diagrams the heart online in your books. It's pretty good. All right, what I'd like to do is, how about we take a short break, if that's all right with you? Maybe a short 10-minute break, get something to drink. We're going to reconvene back here, and what I'm going to go into next is I'm going to start getting into tubes a little bit, okay? We're going to do tubes. I think we're going to do glucometer checks tonight. If we have time, we're going to do blood pressure, so we have a lot of information, okay? All righty, great.
Julie.
I'm trying to get you. I know.